Welcome.
Very good. For the record, my name is Kevin Fitz. I'm a volunteer with a nonprofit organization called the Oregon Mental Health Consumer Association. Just a little background about myself. I'm an Oregon Health Plan member, received behavioral health services and primary care services from CARE Oregon. I want to say Senate Bill 432 plus the -1 amendment. This actually is not a new piece of government. Governor Kitzhaber started this when we expanded behavioral health into Medicaid managed care. He set this project out in 1997, proffered an RFP on the ground in 1998. This project went on for 6 years and then ultimately, unfortunately, under the Kulongoski administration, was cut due to budget cuts. The initiative that Governor Kitzhaber got from this was from the national federal mental health services arm called the Center for Mental Health Services has been funding technical assistance consumer-run centers since 1992. And there's currently 3 of those and 2 extra ones that are led by family concerns and family initiatives. This project has merit. This project has veracity. We've done this before in Oregon. Simply what this is organized as a community-based project led by individuals who are previous or current consumers of the Oregon Health Plan to do 3 things particularly. One is to educate the 250,000 people who are on the Oregon Health Plan what it means to be a Medicaid recipient, what a CCO is, what are your rights under the law, what happens if you can't get a QMHP and psychiatrist, how do you advocate for yourself? I don't know if you've seen the organizing chart of what our systems and where care coordination comes from. It's very difficult to navigate without a guide. Secondly, around the issue of consumer involvement and policy, you may remember, some of you may remember, 4 years ago, right before Representative Greenlick passed away, one of the things he was asking was the governor's office and the Oregon Health Authority, how many boards, councils, committees, work groups, and task force under your behavioral health department do you have? Last count before COVID, there was 43. Currently, we have about 60 of those. There is a state law that says every single behavioral health council, work group, and task force has to include 20% of what is considered defined as a consumer. The question that we have, and as a consumer, and one thing I think my greatest gift is my Rolodex. I know an awful lot of serious people who believe in some of the novelties and some of the things that we put forward for progressive mental health reform. The challenge is we have seen the deterioration and the feedback loops of the primary consumer to the service provider and to the system who makes these policies evaporate. There are certainly some and some decent projects internally. We're talking about a community-based project of a nonprofit that does specifically those 2 things, educates the consumer and helps mentor, train, and engage the consumer in policy activities. And not only are there 60 under the behavioral health state of Oregon, across the state of Oregon, every county has a requirement for consumer voice, every CCO, every major player like Cascadia Central City Concern. This is work that was done 25 years ago and the outcomes were terrific. So this project has veracity, it has merit, and has value. Unfortunately, as all the things that we have supported have gotten somewhat confused in why is an outside volunteer nonprofit trying to reshape OHA? And oftentimes it comes with some friction and some challenges. Representative Hayden and Representative Nost were the chief sponsor of SB-432, the peer respite bill. Governor Kitzhaber sent me to New Hampshire 20 years ago to look at that project. We are almost to the end of the biennium with SB-432, and they have yet to finalize the awards. There are some challenges. We know that we're having a new leadership at behavioral health coming in, and we're looking forward to that. We think this community-based initiative has veracity and merit, and it gives some spirit and some hope to people who are lost with no cultural, no community, and no connections of each other. And this project deems to support that viewpoint. And there's a bunch of other people who can speak more clearly than I can about this project. So thank you for allowing me to speak today.
Thank you for your testimony. Much appreciated.